My name's James Althouse. I own a corporation that I created. It's Althouse Construction Group, Inc., and I'm the president. I've had seizure disorder for 28 years. I was in the United States Navy as a Polaris Electronics missile tech. I was in for a 6-year program, but after a year started having seizures. I had a seizure disorder that was created apparently from a calcification, this piece of calcium about the size of a ping pong ball in the backside of my brain.
So Mr. Althouse has had a really long history with epilepsy, with a lot of different things going on. At first, we were able to really control his seizures well with medication.
The goal of treating seizures with medications is ideally to stop all seizures from happening.
Anti-epileptic medications work by kind of quieting down the brain. In epilepsy, the brain becomes overexcited very easily. So the medications work to keep the brain from being overexcited.
Medications are quite effective in the treatment of epilepsy. Most patients, about 2/3, will be quite well controlled with just 1, sometimes 2 medications without significant side effects and really good control of their seizures.
There were so many medications that they were trying me on because you know, with these seizures, I wasn't able to drive. I was having a hard time with my schooling.
Before James had good control of seizures, things were chaotic, to say the least. He never wanted to stop doing anything or being at social get-togethers or gatherings, or he didn't want to miss a beat. So what that then meant was he was going to seize, you know, at church. He was going to seize at restaurants. He was going to seize on buses. He was going to seize walking down the street, riding his bike, in elevators. It happened everywhere.
The previous drugs that we've used before were more for generalized seizure disorders, and they did have side effects, and their dosing was a lot more complicated.
He was always frustrated, but he would never verbalize that to me. He would never say those words to me. He would never show it to other people.
The medication doesn't just target magically the one area or areas that are responsible for causing a person's seizures. So essentially, once the medicine's in the bloodstream, it's going to have effects throughout the entire brain and nervous system. And so common side effects are people feeling sometimes like their thought process is not as clear or as lucid, as fast.
Some of them are getting you really dopey, slurry, and having a hard time remembering things.
One of the side effects that we see is sedation, fatigue. So basically, patients will get very tired easily. They will be drowsy.
There was a time when he was very, very whacked out on medicine and hard to deal with, hard to talk to, hard to communicate with.
Some medications can have the possibility of worsening depression in patients that have it, which is why that's something we always try to assess before starting certain classes of medications.
You know, I thought maybe I wouldn't be around for the future, you know, but a lot of that was not his fault. You know, his medication was wreaking havoc with him. He just was kind of out there. I don't know how else to say it.
The serious side effects that we watch out for with some of the anti-epileptic drugs are rash, liver failure, and bone marrow depression, where the anti-epileptic drugs impact the blood cell lines in our body.
Over the years, we have increased the number of medications that we have available to treat epileptic disorders. Many years ago, we had a choice of a few. Side effects were very challenging, but the newer agents that we have, the newer ones that have come out over the last few years, have offered easier dosing for our patients with less complications and side effects. seizure medication is not to be taken as needed. It needs to be taken as prescribed. So if it's once a day, it needs to be taken once a day. If they skip a dose or they forget a day, often that's fine. They could link up the next day. But if they skip a few doses, that could be problematic in that their seizure disorders could come back.
They might not have that much of a safety margin, basically, as far as going into recurrent seizures. And so this can be very dangerous because when you have repeated seizures, that's actually potentially a life-threatening condition.
And this is when a medication tray would come in handy, like a 7-day tray where the patient could actually load in their medications for the week.
And as I set that up, I know that I've got everything in there that the doctors have mandated that I do. I put that in there, and then there's not a problem just opening that in the morning, taking what I need to use, and leaving in what I need for the next point in your day to open it up and take that other medication. It makes it real simple.
There was a time in our married life when I was way more involved with all of that. I was helping him all the time with everything, but he's doing so well now that it's just kind of a nice, friendly, hey, did you take your medicine, reminder. And now it's just part of his daily routine. He knows he has to have it. He can't. It's just like brushing your teeth or brushing your hair.
So what we always recommend to all patients is if it's a drug you use all the time, when you get your first fill, you could then actually process your refill. The patients could do that by phone. They can actually do it on the computer if they're registered in My Healthy Vet, or they could mail in a refill slip.
You have to call in, which is a simple deal with the VA. Just looking at the numbers there, you can call in and ask for the meds, and bingo bango, you'll get it coming by the mail.
The medicine that he takes has definitely helped him to be successful, in his work and in school and as a husband and as a father.
I'm living my life to do whatever I can in serving other people and trying to be a husband with my wonderful wife and a father to my children. And I just don't know how anybody would do it if they weren't a veteran and didn't have them performing that with the ability that we have.
I would say I love the VA. I'm grateful for the VA, and I know sometimes the VA gets a bad rap, especially lately, but the VA has done good by us.
You want my opinion? I have the best doctors in the world.